On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services Support webinar series. My name is Delina Mobley, and I work for Kaufman & Associates. I will be the moderator for today's webinar. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window, where you see the PowerPoint slide. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. A Q&A session will take place after the presentation. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You'll receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I would like to welcome everyone to today's webinar. Today's webinar is titled Tribal and State Elder Justice Collaborations at Work. We have 4 presenters with us today. I will introduce each one. Cynthia LeCount is the Director of Office for American Indian, Alaskan Native, Native Hawaiian Program since January 2012. Ms. LeCount has oversight for Older Americans Act program, OOA, that serve American Indians, Alaska Native, Native Hawaiians, and diverse elders of racial and ethnic heritage. Through her oversight, tribal elders and diverse elders of African American, Hispanic, Asian American, Pacific Islander heritage, and LGBT elders benefit from OAA Title III and VI nutrition services. 3 resource centers dedicated to tribal populations and the 5-member National Consortium for Seniors Equity. Jackie Gray is the Program Director for the National Indigenous Elder Justice Initiative and Associate Director and Associate Professor for the Population Health Center for Rural Health at the University of North Dakota School of Medicine and Health Services. Marcia Hall is the Adult Protection Services Representative for the Shoshone-Bernock tribe of Fort Hall, Idaho.
Hello?
For the past 7 years, she has organized a 2-day elder abuse prevention conference, taking a stand against elder abuse at the Shoshone-Bernock Hotel and Event Center. Ms. Hall's long-standing experience has given her the opportunity to better advocate for lifestyle changes for the elders of her tribe and initiate elder abuse Multidisciplinary Task Force Committee and the first community board guardians for the Shoshone-Bernock tribe. She believes in focusing on 4 areas of health for her community: emotional, physical, psychological, and spiritual. Helen Gray is an elder abuse prevention coordinator for the St. Regis Mohawk Tribe Office for the Aging. Thank you all for joining us today. I will now turn it over to Cynthia to offer an introduction into today's topic.
Good afternoon, everyone. I hope you can hear me and I'm coming through all right. I am so pleased that you've called in for this webinar. It's a very, very important topic, and sad to say, it's something that truly does happen in Indian country. Realizing that many of you are from our long-term services and support programs throughout Indian country, we are talking about the elder abuse that occurs generally to seniors who live in their own homes and communities, and that would be handled by social workers or senior program staff. If we were in nursing homes, this type of abuse would be handled by long-term care ombudsmen. Tribes first started talking about and working in elder abuse and neglect in 1985. At that time, the Administration on Aging granted funded 3 grants, one to Great Lakes Intertribal Council in Wisconsin, working with the 11 tribes in the state, one to Navajo Nation, and one to the Yakama Nation in Washington. Those were our first 3 federally or locally funded programs talking about elder abuse in Indian country. We were given funds to do public awareness and education at that time, so we were just starting the conversation about elder abuse and neglect in Indian country. And of course, we were met with a lot of, oh no, we don't abuse our elders. They're very important to our tribes historically, culturally. They're our teachers. They're continuation of our culture, and on and on and on with the usual rhetoric that we talk about in Indian country. However, the elders were telling me very differently that they were being abused, and they were even defining different types of abuse. We began the program talking physical abuse, financial abuse, neglect, and self-neglect, allowing an elder to neglect their own care. And we quickly added from definitions from the elders talking about cultural neglect or traditional neglect, where we are leaving them out of our traditional events. Oh, Grandma, it's too hard to pack up your wheelchair and your blankets and your oxygen machine. It's too hard to take you to the powwow. I'm just going to leave you home this weekend. We'll tell you about it. We'll take a picture. Elders also talked to us about neglect by younger family members, and this was a very hard one to talk about and a very hard one to start looking at. But when we as younger moms or granddaughters or nieces, nephews, whomever, are going to go play bingo for a few hours, so we say, Grandma, can I leave the kids with you? I'll be back it's 6 o'clock now. Bingo should be over by 9. I'll be here to get them at 9:30, 10 at the latest. Don't worry, Grandma, I'll come. But then we forget to go. And sometimes we don't go back for a few days. So Grandma's worried where we are. If we're okay, all of a sudden she has to get the kids ready for bed, wash their laundry because they might not have clean clothes for the next day. She has to make sure their schoolwork is ready. She has to feed them, and she might not have enough food. She has to get them up early, get them ready for school, put them on a bus, feed them breakfast, and the list goes on. And the elders talked about that, not that it isn't something they want to do, but something that is and can become abusive or neglectful. So we started 33 years ago talking about elder abuse and neglect in Indian country, and we've had a few little spices and flavors we've added to that throughout the years. But we've never really gotten our programs off the ground and absolutely running, of course, because of funding. Under Title VI of the Older Americans Act, we can work with elder abuse and neglect, but we don't have any money specifically for those programs. So these programs have kind of been like an afterthought until the last few years when Administration for Community Living funded our National Elder Abuse Resource Center that Jackie will talk to you about, and we were able to fund some innovative programs. We have 2 of those ready to talk to you today. And this is every dream I've ever had about elder abuse and neglect programming in Indian country that is now coming true once we've been able to turn some money over to the tribes and say, develop some innovative programs that will keep your seniors safe in your communities. So with that, I'm going to turn it over to Jackie Gray. I had a PowerPoint that I didn't even begin to try and follow, but it will be included with the general PowerPoint from the session. So, Jackie Gray, you're on.
Thank you, Cynthia. Good afternoon, everyone. As Cynthia said, I'm the director for the National Indigenous Elder Justice Initiative, which is the National Tribal Elder Abuse Resource Center. We have a website that's nieji.org. And on that website, we have a lot of resources for tribes to address elder abuse, from what are some of the warning signs. We have a Native Elder Protection Team toolkit that can tell you how to develop that elder protection team. We have some online interactive educational modules for caregivers, financial exploitation, healthcare providers, legal, policy, social services. We also have a general elder abuse module that can be used with your community elders or any group in the community if you want to teach them a little bit about elder abuse. And up at the top of our homepage, there's tabs that talk about, that have resources, elder abuse codes, and we have a number of elder abuse codes for different states. Hotlines, we have over 7,000 hotlines listed by state, and then within each state, they're listed by tribe, by county, district, however your state does them. And then we have the Innovation Grant, where we have the Elder Maltreatment Survey that's available for tribes to gather data to find out what's going on in their community about elder abuse. As I said, we also have the small grants that we gave to tribes. We had 2 cycles, and there were 8 awards given during each cycle of $20,000 each for them to develop an innovative approach to addressing elder abuse in their community. And this is a copy of the survey that kind of shows what it looks like. If you want to collect your data, we will process it and give the information back to you in a way that you can make use of it in your community. So with that, I'm going to pass it off to a couple of our tribal grantees, starting with Marcia Hall, to tell you a little bit about what they're doing with the grant they received.
Hi, good afternoon, everybody. This is Marcia Hall. I'm really excited to share some of the information that I was, like Jackie had mentioned. You know, I am a recipient of one of the innovation grants. With that said, one of the things that I did with that was I focused on 2 areas. One was to start an elder abuse multidisciplinary task force, and the other one was to start a community board of guardians. In 2017, November, I actually was able to hire a part-time individual who was my project coordinator. Her primary focus was to draft up, working with our local board of guardians, the bylaws and procedures for not only the task force, but also for the board of guardians. So that was a pretty lengthy process, but we got it done. On July 31st, 2018, our Fort Hall Business Council approved both those resolutions. So with that said, we were able to go ahead and start the process, which has been really, really a great task to have at hand. My task force. Basically, one of the primary focuses for the task force was not only to coordinate efforts with programs on and off the reservation, but we also wanted to coordinate our efforts in promoting physical, mental, social, and spiritual wellness among our elders and vulnerable adults. This is a great opportunity for not only the programs to enhance their services, but also to educate the other members that come to the table. One of the things, like I said, the objectives, coordinate care of the patient, promote continuity of care, update the members of new services and programs, also to identify some of the service gaps. You know, in the past, that was one of the areas that a lot of us took upon ourselves. You know, when I first got into this position over 10 years ago, I thought I was the only person that was addressing these issues. Little did I know that there was more than one person could at least have maybe 4 different programs working with them so that they could enhance their services, like if they're on dialysis or if they're maybe got cancer, maybe they're homeless. So one of the things that that as the task force, I sat there and I thought, okay, who am I going to actually include on this task force? And after the many cases that were referred to me, it was a no-brainer to include like a 477 consumer services program. They do the LOCKEEP and rental and emergency assistance. We have our diabetes program, so we have an RN that educates our patients. That's foot care, and then we have our community health nursing RNs that actually give us updates on individuals that they see, or maybe they've actually witnessed maybe elder abuse going on in the home. Fort Hall Housing Authority, our representative, she's been great because actually she offers not only the budget counseling for the clients that can actually hopefully be successful in being homeowners, but also offering different services like rental services, and it's been great. The other one is our Southeast Idaho Council of Government Adult Protection Services rep. That itself, working with an entity off the reservation has been beneficial, not only for our members, but also other federally recognized members of different tribes. They offer the Meals on Wheels. They also offer the personal care and as well as the home care. One of the things that's been unique about this is while we're at the table, if there's something that maybe they had seen at the state level, they can actually bring that back to the group, and we can actually do more thorough research on that and actually implement some of those. And it's been phenomenal. Our elderly nutrition representative, which actually gives us updates on who they see on their routes. We also have a patient navigator for the cancer patients. This person helps out with not only their continued care, but also assist with food stamps and as well as Social Security and Medicaid and Medicare applications. We have our EMS Fort Hall Fire Department manager, and he comes, and it's been great because if there's somebody that's been seen on many occasions on a daily basis or sometimes on a weekly basis, we can actually send out for instance, if I have an individual that is calling EMS for maybe, chronic pain, then we can actually have the nurses go out there, do an assessment, and basically from there, then we have the option to follow up with the doctor. Well, this person needs to come in. Maybe we need to have transit come pick them up. And so it's been nice because, like I said, sometimes, as adult protection services, you can't be in 2 places at once. So this has been very beneficial for this task force. The other additional key component to this task force is to actually have a member of the Business Council. He's been very supportive, and basically any individual that goes in front of them that has been on our radar and maybe they're complaining about services not being rendered, this member can actually say, you know what, they have been doing it, and this is what the case plan has been. Not breaking confidentiality, not really, but in a sense of showing the team that not only are they enforcing what we strongly believe in, but also showing a little more teeth to the program. The next slide is a picture of my task force. I can't say enough about these individuals. Like I said, we meet every Tuesdays, once a month, the last Tuesday of the month, and basically we meet for about an hour and a half, depending on what cases we have brought forward. We basically receive referrals. If we need to have, maybe for myself, if I need to do a welfare check, or if I need to maybe start the process for maybe a guardianship or a protection order, or even starting a power of attorney. I mean, this is what's been nice about this group, is we've been able to work together to make our jobs easier, as well as providing more care for our patients. Like I said, we meet every month, the last Tuesday of the month. We meet here at the Justice Center, and we have a structured agenda. We go over previous minutes. We do minutes. We have a secretary that does the minutes and provides that copy every month to our members. So it's kind of a nice reflection to look back and say, okay, this person, I remember them like 3 months ago, they were having this problem. Now they're having this problem. So it's really saved a lot of memory, I guess you would say, kind of like reflecting back on what you know that needs to be done. Maybe you hadn't done the referrals or whatnot, but it's been great. Our Community Board of Guardians, that also is a volunteer court-appointed guardian conservator for individuals, incapacitated, vulnerable adults. And basically the role for those individuals is to make sound decisions regarding their health, finances, and well-being. The volunteer, like I said, initially when they apply, they would go through the tribal personnel program, and they would go through the hiring practices so that they can have a background check. And basically, we would have 5 individuals come to the table. The whole focus is to actually have elders be a part of this board, so that we don't have individuals maybe that are with a background of being in a system. Maybe they've been convicted of drugs, or maybe they've been convicted of theft. We just want to make sure that the individuals that are referred to the board would actually have the opportunity to have somebody to help them along, or even initially have another family member in the time being. The board actually, I know I'm bouncing all over the place, but the board actually would be in place for 90 days. Within the 90 days, that gives not only the board, but also adult protection to seek out a family member that may be out there that nobody had known about, but actually looking at another alternative for that individual, rather than having individuals making their own decisions where maybe they've got dementia, maybe they've got some kind of severe illness, maybe they've been incarcerated so many times because of inhalants, drug abuse. I mean, it goes across the board, and a lot of times when I go to the hospital, or if I get referrals, and we have social workers that are saying, hey, this person really needs a guardian because they're not making sound decisions. It would be nice to have our own board to make those decisions. And one of the things right now is I've been very fortunate in the past 10 years that I've been here, that I've been able to reach out to like our coordinating communities, the Bingham Board of Guardians or the Bannock Board of Guardians. And, you know, it's been, and as well as not only that, I know that jurisdiction always comes into play, but one of the things that's unique is I've been very fortunate to have the Business Council support in most of those isolated situations that I do have to take an individual's case off the reservation. And in that time, in the 90 days, I'm able to locate another family member, or sometimes, unfortunately, maybe it was end of death decisions that needed to be done by somebody that would make those decisions for them. But like I said, that's very rare. The Board of Guardians would be kind of like on a last-ditch, this is my last-ditch effort to get a guardian. If I don't have a family member, or maybe I've got family members that are squabbling over finances, and that's one of the things that really makes things difficult is without having that full accounting, it makes it where who are we really protecting? Are we really protecting the individual, or are we protecting the perpetrator? So the members' requirements, one, like I said, they would have to go through a background check, which they also would have to go through a HIPAA training so that they can ensure that they understand what their do's and don'ts are with regards to personal information. The other thing, too, is that we would also have all the files. They wouldn't have access to the files because everything would be locked in my office, in the Adult Protection Services office. So nobody would have access to that except for myself. And the cabinet is locked 24/7. And then they also have to understand, they're doing this as a volunteer process. They're not going to be paid. And I know a lot of times, people want to be paid for their time, but I look at it as this. If I have an individual that really needs a guardian and I want to ensure that they're being cared for and they are maybe an elder that had a lot of significant influence on the reservation, I would be more than happy to help them, but I wouldn't necessarily request payment for that. And I think that's really one of the things that we've kind of lost sight in is the almighty dollar seems to make more sense than doing things just the goodness of your heart. But the other thing, too, is that with the Board of Guardians, we haven't necessarily started that. I mean, I've got the foundation already set up. It's just the lengthy process of going through the attorney reviews for the tribal attorneys to review those and then going back in front of the council was quite the task, but we got it done. So now to adjust to actually implement the Board of Guardians into the tribal code, we would have to do a modification. And, right now we've had numerous incidents on the reservation with deaths, and so it's been pretty hectic. And then we've had several holidays that kind of threw everybody off too. But needless to say, it's still going to get done, irregardless if I'm under a grant or if I'm not. It's still these past 10 years I've operated without a grant, and I'm bound and determined to see this go forward. And from day one, that was my whole intent. The board application, again, it was not only would they fill out an application for the tribe, but they would also fill out an application to be a board member. Also, any individual that was to refer a client for the board to review, they would have to fill out an application. Again, a 3-page referral basically states their medical needs, medications, if they have Social Security, if they have Medicaid, what do they plan on, what are their intentions on for this individual to be successful with their daily living. Most of the individuals right now that I do work with are coming out of the system. Since I am housed here at the corrections, next to the corrections department, so a lot of times that's one of the things the social workers there always ask, well, they don't have somebody to make those decisions. They really need a guardian. And so, like I said, having them review a lot of these, what needs to be on this application was pertinent because I wanted to make sure that every information was on there, so we weren't having to race around and call around and make sure everything is on there, and it's just all on one place. The other thing too is the Board of Guardians would actually do an inventory, just like anybody else. You have your checks and balances. They would ensure that everything was all said. They would do a yearly review, and basically on that review, they would turn around and explain why they made this decision. If we had a per capita disbursement, where did that per capita go? And so a lot of times, in my field, I've noticed that, I'm all for per capita, but when it comes to per capita or large payouts, those are the busiest times ever, because I have individuals that are wanting grandma and grandpa's money, aunt and uncle's money that may be wheelchair bound, dialysis, and it's a hindrance in some sense. And a lot of times, especially with the benefits with Social Security, it makes it difficult. But like I said, I'm not against per capita. That's a different story. But I did do my Board of Guardians brochure, explains every process that would needed to be done for a person to get a guardian. The resolution that illustrates that the council did pass it. Some of the events that I had conducted here on the Fort Hall Reservation from 2011 to 2018. I'll show you those, but I just want to say the two ladies in the picture and the show band news, these are my late grandmothers, Laura Peschlepie and Josephine Miller. Josephine Miller, I have to say real quick, she was a very unique lady. She didn't have running water. She went outside every morning, pumped her own water from the well, and she never was in the hospital or anything like that. She just died of old age, and she died in her mid-90s. One of the things about it I love about this picture is you don't see these individuals very often. Most of the time, like Cynthia had said, most of the time they're maybe secluded in a home because, like you see my grandmother Laura's walking with a cane. When they're hindered by their physical limitations, individuals take every excuse possible not to include them into activities. And, one of the things I always say that working with the elders has been such a humbling experience, and I wouldn't trade it for anything because I love my job and I love the individuals that I get to help. There's always, goods and bads of things, but for myself, I try to be well equipped to handle different situations. I'm not just only adult protection services, but I do a lot of volunteer services, but I also like to bring information to my elders so that everybody is on the same page with services. Like, for instance, doing the Indian trust probates, and we're going to start that back up. I would have the team from BIA, and they would conduct, recent changes or updates, or maybe they want to have their own land and whatnot checked into. Doing their own Indian wills, that's another thing. And also creating a resource guide, because a lot of times, for instance, it never fails. I always have somebody call in, hey, what is the number to the clinic? What is the number to transit? Well, you know what? I have a guide that will show you exactly where everything is. You can call them, you can email them, and whatnot. Moving on with grief, with our loss of our loved ones and stuff, it's kind of nice to have other people that might be having the same grief and thinking that they're only by themselves. It's nice to have an outside source come in and kind of give us that push to support one another. Every year for the last since 2011, I've had an elder abuse prevention event. Initially, when I first started it, it was just an idea. And I have to say, I'm really thankful that throughout the years, it's gained momentum. I've been very fortunate to have a unique speaker such as Wilson Wewa Jr. He's been my keynote speaker, and when he speaks, it's like the room stops because his voice commands attention. And the other thing about it, every year, the way I construct the agenda is I look at things that I'm seeing more cases of, like if it's addiction, or if it's, let's say that we have fraud, or if we have mental illness. And so each year is something different, but we also enhance those. So that first it was a one-day event, and maybe it was only half a day, and now it's a 2-day event. And I'm not kidding. I can see it happening another 3 days because, like I said, it's been gaining momentum. I have outside sources. All my vendors are senior care programs that can give that informational pamphlets, you name it. They can actually be there to meet with those individuals, and then as well as they themselves get to hear firsthand what exactly these programs might have available for them. Like last year, for instance, I was very fortunate to have an individual come and talk about Stop the Bleed, which is open wounds. And they gave everybody in the audience an opportunity to actually go through, put a tourniquet on, and actually stop the bleed of a wound by gauze, whatever mechanism. And people really took to that. The other thing was having a speaker on hoarding. That's one of the things that, as not only unsanitary, but it also, we have young children, and even, like I said, even our elders living in situations like that. And it kind of put to light a lot of our discussions that most of us kind of think, am I a hoarder or not? I see aunt and uncle having all this stuff, and so, like I said, it just it's nice. One of the things that I also have every year is we have our Fort Hall Police Department do a presentation on drugs on the res. They actually bring in seized drugs, illicit inhalants, meth, heroin, cocaine, and they bring it to the table, and actually the elders have firsthand of what exactly they are. And I'm telling you, right after the event's over, we have referrals, we have reporting, because grandma and grandpa or somebody never knew that they had all this stuff in their home, and it was there. And like I said, it's been a really great opportunity, not only as an education, but also, for us as care providers to be on the up and up on what services are there or what we need to look for to protect our elders, our vulnerable adults. And so, with that said, I would like to extend an invitation. This is just to save the date for our 8th annual Taking a Stand Against Elder Abuse. We usually host it at the Hotel and Event Center. Beautiful location. We usually have a lot of fun. We offer dinner, and this year I'm hoping that, we make it a lot better. Each year from the surveys, we kind of see what people are looking at and people want to see on the agenda, and that's how we kind of come up with also, in addition to what we see in the cases, but also the clients and the attendees would like to see next year. It's their event. I always tell them firsthand, choose your color for next year for the shirt, and then basically it's your event. You tell me what you want, make it happen. So, but I thank you for your time. Sorry to ramble on so much, but Here's my information. I'm available by cell phone, by my work phone, email, and but like I said, it's been a privilege, and I'm really honored to have the opportunity to be a recipient of the innovation grant. And with that said, I will pass it on to Helen, and I thank you for your time.
Hello, everyone. My name is Helen Gray. I work for the St. Regis Mohawk Tribe Office for the Aging. I am the Elder Abuse Prevention Coordinator / MVP Coordinator. Our multidisciplinary team is the Akwesasne Elder Abuse Committee. And a little bit about what we're doing. We also were a recipient of the NEJI grant. We got $18,000 for our Elder Justice Initiative. So what we did was we had to start from ground zero and work our way up. We're new. Our group just started meeting in February of this year. We got the grant in September of 2017, and we didn't start doing anything with it until mid-October when we started doing the elder maltreatment surveys so that we could get the numbers that we needed to find out if there's a prevalence of elder abuse within the St. Regis Mohawk territory. So the demographics that we've received, because of where we are sitting, our reservation is complex. So we'll go over that in a little bit. But we got a total of 40 participants to do the actual survey. When I was going out and campaigning for people to do the survey, they were real happy to see me and everything, and they were like, oh, what do you got a survey on? And I'm like, oh, I'm doing an elder maltreatment survey. Would you be interested? And then they're like, oh, no, that's okay. And it's because it's such a hush issue, nobody wants to talk about it or basically believe that it's happening in our territory. It makes it really hard to get that out there, the awareness and the education. So on this slide, honor, dignity, and respect. The elders are essential as guardians of our tribal history, culture, and traditions. I know within our territory, we really hold our elders in high regard. They know everything. If you need to know an old recipe from way back, they know that. And it's being able to take care of them and make sure that they're still living very productive and happy lives. It's really important for us to continue to allow them to live that way. The elders, a lot of them won't report abuse due to fear or love of the abuser, lack of resources, distrust of government, historical trauma, and appearing vulnerable. And with the lack of resources, what makes it hard around here is that because of where we are positioned. So our elder abuse team is elder abuse case review, and we have a victim-focused approach. So we are all here to work for the elder and make sure that they don't slip through the cracks. We want to reduce the stereotypes around elder abuse. We want to address the lack of standardized protocols and improve the coordination and communication between the service agencies. Thereby, we're saving the elder and the family valuable time, stress, safety concerns, things of this nature. So in January, I went through a list of people that I thought would be valuable to this team, that they would have a lot of resources and be able to get the synchronicity going really well so that we can be productive for the elders. Our elder abuse case review objective of when we first met in February 2018, the objectives here are the ones that we applied for the grant, and this is what we wanted to this is what we wanted to do with the grant. So we wanted to, at the time, our current objective was to create our elder abuse team and develop a standardized definition for elder abuse. And then our future objectives were education and awareness, removing the barriers, developing centralized reporting and referral system, and developing a tribal elder protection code. We knew that we weren't going to be able to complete all of these within 1 year. So I went and I sent out the invitations. I sent them out by email, and some of them got back to me, some of them didn't, and that's okay. So I sent out, I think, about maybe 15. I sent out about 15 of them, and then I got back like maybe 7, I think. But at our first meeting, we discussed the committee's role, that the representative from the agency participates in regular meetings or will arrange for an alternate when unavailable. Also providing information about our committee to their agency to increase awareness and to let them know that we've got this team here that is willing to help out in any way that we can to make sure that the elder is safe or removed from harm. Another one of the roles for them is to make sure that they provide expert input and review of the cases. Also to make sure that the appropriate follow-up for the elderly client, because we don't want to tell them, oh yeah, we're going to take care of this, and then they don't hear back from anybody. So we make sure that that they are involved in what we are doing. We also to provide support and validation assistance to other committee members. So this is our elder abuse case review team. This picture was taken on June 15th at the World Elder Abuse Awareness Day. We had an event at the Akwesasne Mohawk Casino. In the back row, left to right, and the first one, Isaac McDonald, the acting supervisor in Akwesasne Mohawk Ambulance Unit / volunteer firefighter. That was his first day as a member of our team. He showed up and he's like, hey, I finally looked at your emails and seen that you wanted me to be a part of this team. He's like, I'm on board for it. And he was ready. He had all his stuff together and everything for the Elder Abuse Awareness Day to set up booth, which is awesome. We also have Kristen. Kristen Post she really helped out with us. She's a former Adult Protective Services, but she was really like gung-ho, like we could do this, and this. And she went and she got a job in the Social Services Department, so she's no longer a part of our team, but she really did help out, and we do appreciate her time. We also have Lori Shaw. She's Adult Protective Services. Laura Lee LaFrance, she's the director for the St. Regis Mohawk Tribe Office for the Aging. Willie Nelson, oh my God. Willie Ransom, Inspector for the St. Regis Mohawk Tribal Police. And then the front row, we have Rachel Jacobs. She's the Healthcare Services Supervisor for the Tribe's Outreach Program. And then myself, Helen Gray, I'm in the middle. And then April White, which is the Program Manager for the Mohawk Council of Akwesasne Home Care and Home Support. The ones that are missing is Norman King, Community Support for Akwesasne Mohawk Police Services, and Matt Rourke, he's the Chief of Police for the St. Regis Mohawk Tribal Police. So this is what makes it tricky. We were trying to get the elder abuse definition for the territory of Akwesasne. Our territory, our reservation, is straddling all of these lines that are like dissecting our reservation. We have 2 countries, 2 provinces, 1 state, 2 counties, and 3 districts that all are within our territory. We have the United States, Canada, and we have Quebec, Ontario, New York State, and we have Franklin County, and we have St. Lawrence County, and also the St. Regis and Gowanoga districts within this territory. So we have multiple definitions for elder abuse from all of these places. Also, the ages to qualify to be an elder vary from district to district. In Ontario, I want to say 62. I'm not 100% on that, but I'm pretty sure it's like 62 or something like that to be considered an elder. So how do we define elder abuse in Akwesasne? So we got together and we met, and what we decided was that the definition of an elder is defined as an individual 55 years and older in the territory of Akwesasne. The elder abuse is the infliction of physical, financial, emotional, sexual, psychological, neglect, and or spiritual harm on an older, possibly vulnerable adult at the hands of a family member, a non-family member, in a trusting relationship, or a caregiver in an institution. This also includes self-neglect. So education and awareness. This right here, I had to write stuff to Gray about it and see if we could use this, the poster, Ways to Love Our Elders. What we did was we took that in May of 2018 and we blew it up, put it on a billboard, and that billboard was in between the bar and the casino. So if anyone was pulling in at the bar or pulling past to the casino, they were seeing this sign. And a lot of people noticed it, and a lot of people made comments to me that they had seen the sign and they were asking about it. World Elder Abuse Awareness Day, we held that June 15th at the Akwesasne Mohawk Casino. We had all these vendors come in. We had total of 50 elders actually show up and go around and got freebies and everything like that. And the third picture over on the top, that's the one to Hawita Pulse. These are health educators. She was teaching them how to do line dancing. So, and then we have like APS. There was a variety of programs that were involved. On the bottom two pictures, the bottom two right, there's myself, and then there's our sub-chief, Tweet Jacobs, and then the bottom corner picture is myself and also our chief, Beverly Cooks. So education and awareness. So we had a T-shirt and bumper sticker campaign on August 17th. At the Office for the Aging, we had a senior picnic, and I ordered all of these shirts and bumper stickers to give away for the awareness and everything. And it says on here, this person has zero tolerance for elder abuse. And the top picture here is myself and my coworker, Brenda LaFrance, and also Gordon Delarmy. He's one of our people that comes in every day. He's a really great guy. And the bottom is some of our staff here at Office for the Aging, and also Katie Boots' beautiful little babies in there too. And we're just showing that we all wore those shirts that day, and to show that we're there for the elders, that if they need help, if they want to talk about anything like that, that we're there and we're supportive of them. Okay, so this is a continuance of it. August 17th isn't the correct date where these pictures were taken, but we were given these pictures, these bumper stickers out. Zero tolerance for elder abuse, see something, say something. So when I discussed this with the tribal police and the Akwesasne Mohawk police, which are both on, the tribal police is New York State tribal police, and then the Akwesasne Mohawk police is the Canadian portion, so they cover St. Regis, Shoshone-Bernock, and Akwesasne. So I asked if we could put these stickers on their vehicles, and they said yes. So we had a big media release and everything. It was really awesome. The elders came over, they put the stickers on for us. They all have these T-shirts. They all have the stickers. So we have completed 4 of our 6 current objectives as of September. We're still working on developing a centralized reporting system, and the Tribal Elder Protection Code. When I spoke with the ones that were taking care of the code, they were saying that it's currently, the tribal code is in the infancy stages, so that probably won't be happening for years. And I don't want to take up any more time, so if you have any questions or anything that you would like to contact me for, my information is right here. My number is 518-358-2963, extension 6312. We have a fax, and also my email address. It goes right to my phone, too. If you need to get a hold of me, if you have any more questions about what we do up here, and if you have any questions about what we have going on up here, I really am looking forward to answering them for you. Thank you.
Thank you. That brings us to the end of our presentation. I would like to thank Cynthia, Jackie, Marcia, and Helen for joining us today and sharing information about tribal and state elder justice collaborations that work. In closing, I would like to remind everyone that today's webinar was recorded, and the audio and presentation slides will be made available online on cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded. Thank you.